And welcome to Channel 6 News. I'm Max Brown, and tonight we're bringing you the breaking story of oxycodone, commonly referred to as Hillbilly Heroin, the epidemic that's sweeping the streets of Sydney. Since 1992, opioid dispensing episodes have increased 15-fold in Australia, with a cost of $271 million to the Australian government. Originally prescribed for chronic pain and cancer patients, oxys now hit the streets with bad intentions. Flooding onto the black market due to an overprescription has led to more accessible and affordable high for desperate users. Since 2002, oxycodone abuse has jumped from 800,000 to over 2.1 million people in Australia alone. Across the globe, it's estimated that up to 36 million people abuse opioids. So why it's a problem? Oxycodone was initially created in the 1990s to prevent abuse of opioids due to the time-release nature of the product. However, since then, abuse has skyrocketed, reflecting the limited availability of illicit drugs and the relative abundance of prescription opioids. Abusing oxycodone is extremely dangerous and highly addictive. Current intervention mechanisms, including extended release pills and gel formation to prevent injection, are doing little to deter users. When users crush the pills, the safeguard on the time release is invalidated, allowing the users to increase the euphoric effects. So, the big question: should it be used as a first point of treatment? Find out after these messages.
Hi, I'm Cletus. Life getting you down? Do you feel like you need a little help with the humdrum of life? Well, look no further than oxycodone. It's practically easy to get morphine now. Feel like your old self with pharmaceutically induced euphoria, relaxation, and reduced anxiety. Now I know what you're all saying. I've been a long-time heroin user, and it gives me all I need. Well, consider this. Can you guarantee the quality of your heroin and get it at great discount prices? Our oxycodone is obtained from legal and medical sources, meaning it is 100% pure and prescription grade, so no nasty side effects. Well, there are some, but we'll get to that later. Where do we get it, you ask? Well, we have dedicated, hard-working employees getting prescriptions from real doctors. They go to GPs and claim symptoms like chronic pain and cancer. And since doctors can't prove pain, they give us prescriptions. You can even order it online. There's nothing to lose. Did someone mention side effects? I'm no doctor, but it makes me feel good. I do feel obligated to post some fine print, so here it is. Oh, my uncle brother had that one. That wasn't good. Oh, that one's definitely not good. But again, I'm no doctor. Order now and receive a free NutriBullet for all your juicing needs. Once you have your product, it's easy to use. If you're given the new style of tablets, make sure you don't crush the tablets to snort or inject them. Designers have got a whole science seat to stop that. So just take it orally and you'll be a very, very merry way. Easy. Don't wait, order now. Call this number.
Now we'll continue on with Chapter 12, the mechanisms of action for oxycodone, as you can see up there. Oxycodone's mechanism of action for analgesia is poorly understood compared to other pain relief medication. Early studies by Australian researchers indicated that oxycodone acted as a kappa opioid receptor agonist, unlike other morphinium class analgesics like morphine, that are known to act on mu receptors. However, contradictory to the study's findings, oxycodone produces effects such as euphoria that are more typical of a mu opioid receptor than a kappa opioid receptor agonist. This could be attributed to a metabolite of oxycodone called oxymorphone, a product of oxycodone metabolism that has a much higher binding affinity to the mu opioid receptors than oxycodone does. Although it is uncertain which particular opioid receptor facilitates analgesic effects, most opioids have a similar mechanism for blocking neurotransmitter release that is better understood. Once oxycodone binds to the target opioid receptor, a G protein complex that is coupled to potassium channels and voltage-sensitive calcium channels is activated, inhibiting calcium entry into the cell and enhancing potassium leaving the cell. Neurotransmitter release into the synaptic cleft is dependent on this influx of calcium into the presynapse. Oxycodone has another inhibitory mechanism as well though. The G proteins also inhibit adenyl cyclase, an enzyme necessary to break down ATP to form CAMP. Without the second messenger CAMP, the presynaptic terminal is unable to release neurotransmitter into the synaptic cleft. And before we continue, does anyone have any questions in regards to what I've just talked about? No? Okay. And now we're going to move on to another class of analgesics, NSAIDs.
Okay. Welcome back to our main story on oxycodone. Should it be the first treatment option? Australia's ageing population requires greater pain management. However, due to the high addiction rates of oxycodone, other medications must first be considered. As such, other options including non-steroidal anti-inflammatory drugs, pain management groups, and alternative medicines are initially preferred. With such a rampant problem, real-time monitoring is the best suggested solution to slow the oxy epidemic, expanding a system already in place, watching and preventing speed and ice addicts. It allows real-time access to prescription records and allows pharmacies to identify potential users and dealers, denying them access. The current system of handwritten records surrounding prescription opioid dispensing is clearly lacking. Problematic people have only identified weeks or months later, long after opioids have already been distributed. Doctors, pharmacies, and health experts are all pushing, but there has been a very slow governmental response. I'm Max Brown, thank you for joining us in Channel 6 News.